So all of you have gathered. Welcome to the Substance Abuse Prevention Coalition Spring Community Meeting on this April 25th. I appreciate all of you joining us tonight. As you are aware that we are recording this meeting so we can post it on our website. And those who could not join us tonight can get the benefit of listening to the presentation at another time. So before we get started, would you please type your name in the chat and your favorite springtime activity?
All right, so Ida likes to buy flowers. Same. Roy likes to walk. I like to walk and look at the flowers. I should have mentioned that. Tulips. And Alan likes to go hiking, tulip gardens. Yeah, there's a tulip farm not far from here. Lots of good activities.
Okay, lots of people like the tulips and walking. That's great. So thank you. And so we're going to now launch a poll just to get a better idea of who's in the room.
There's another maybe 20 seconds, and then we will look at our results.
Are we good, Emma?
Yep.
Okay.
All right. So I'm going to share the results. Are you able to see the results?
Yep.
Okay, excellent. So we do have some youth and parents. That's great to see. Health organization, government. And I saw Sergeant Branch on here, so we do have some law enforcement there as well. And then other organizations involved in reducing substance abuse. So great to see that diversity of different sectors. Thank y'all for joining.
Awesome. So a nice cross representation for tonight. So speaking about tonight, going to our agenda, we have several things we're going to go over. And as you can see, the welcome. So welcome everybody as we did earlier. And thank you for taking the poll and also letting us know about your favorite springtime activity. And Emma's going to go over and review the most recent Youth First Behavior Survey data. And then discuss the data, and then we're going to discuss some of the data. And then later on, we'll discuss some action steps around the data, and we'll talk about next steps. So this is going to be an interactive event. We look forward to everybody raising a lot of comments and interjecting a lot of information and providing a lot of advice. So please don't be shy. Every idea, every thought that comes out is very helpful for us as the Substance Abuse Prevention Coalition, but also among us tonight even talking. So Emma, with that, you want to take it away and start diving into the data?
Sure. So as Alan said, we're going to be looking at the Youth Risk Behavior Survey data that was recently released. We also have data from 2019, so we're going to be comparing those 2 different years. And this data is self-reported by youth in grades 8, 10, and 12 Alexandria City Public Schools take this survey, and it measures health behaviors. So this is just an overview of the number of responses that we had for 2019 and 2023 for this survey. So when you're thinking about these results, this is the number of responses. And we're going to look at the data by substance. So looking at youth that report using a substance in the past 30 days. That's how current use is measured. Looking at youth saying, I think this substance is, using it as risky. And then looking at perceptions of parental and peer disapproval. And I want you to consider the following questions as we're looking at the data. You can jot it down, you can put it in the chat, but information that confirms your beliefs, that says this makes sense, information that you find surprising, and questions that you have. So first we're going to be looking at youth attitudes and behaviors regarding alcohol. Again, we see kind of left to right in this first table, that past 30-day use among students by grade between 2019 and 2023, perception of risk. NA just means that question wasn't asked. Perception of risk again, and then perception that most of their peers drink alcohol. We also have over here method for acquiring alcohol in the past month. So if you said they used alcohol once or more in the past 30 days, they were given the option to say, this is how I got it. So take a minute or two to think on that. You can type in the chat, you can raise your hand, just unmute if you want to share, again, which of this information confirms beliefs you already have, which information is surprising, and what questions do you have?
Hi.
Hey, Natalie.
Hi, sorry, I had
No,
some trouble connecting. I just wanted to comment, like, I'm impressed at how the low rates of, like, the perception of risk youth have. So around 30% of them actually think it's a great risk or moderate risk to consume alcohol. I guess that's something that can be, there's stuff to work on in terms of education and prevention in that area, I guess.
yeah, thanks, Natalie. I think that's a really great point in looking at, again, factors that we know can impact youth in their decision to use alcohol or to not use alcohol. Other thoughts?
I will just echo what Natalie had mentioned. Is this data, that thing that really jumped out at me and surprised me was the low perception of risk among the youth, and I think that's something that is really surprising. And I guess messaging hasn't gotten out to them about the risk that is associated with it, or they're not understanding or believing in the information that's getting to them about risk.
Something that I was looking at the other day is those on the right, the method for acquiring alcohol, and looking at how that really varies by grade. So youth saying, I got it at a party, that really kind of spikes for 10th graders. And then saying that I bought it at a store, a gas station, that's highest among 12th grade students. And then someone gave it to me, it seems like the highest for most grades. So really thinking about how can we focus our work to target those different access methods based on age of students. And I see Natalie says, and I would add the high percentage of perception that most of their peers drink. Yeah, no, that's a great point. And we share this data and similar data a lot, and youth and adults say, I think it's higher. They say, I think it's lower, or I wish it was lower. But it is interesting to compare that, what you think their peers are doing, and what the data shows is actually happening. It's a great point. Any other comments, questions before we look at our data about marijuana?
I do think it's important though, Emma, for us to just mention that April is Alcohol Awareness Month. And so this really jumps out for us during this month, particularly. Of course, we think about it all 12 months, but just this month and what we need to do in order to make the understanding of the risk better over the next 12 months. So hopefully next year, or when we do the next survey, the numbers will be much more positive in that aspect.
Gloria, do you have your hand up? Go ahead, Gloria. I'm not able to hear you. Okay. You want to type your question or comment in the chat, Gloria? Technology is always fun. Gloria, I'm gonna move to the next slide, but if you want to type your question or comment in the chat, I think that's a good way to move forward. So now we have youth attitudes and behaviors regarding marijuana. So again, that past 30-day use indicator, perception of smoking marijuana regularly as moderate risk, perception of smoking regularly as great risk, and then among youth that reported using marijuana, how did they go about doing it? And I do see that, thank you, Gloria. Gloria put in the chat, just thought about how many of them, you see someone drinking socially, 1 to 2 drinks, and so it doesn't appear to be a big deal. So the risk did not seem high with it. Yeah, I've heard that too of, well, if it's legal, it must be safe. Other people do it, it must be safe. And I think that's definitely a good point to consider when we're talking about substance use, especially in youth. Thanks, Gloria. So is there any information on this slide that confirms your beliefs that, you look at it and say, yeah, that makes sense to me? Or anything that's surprising, anything that brings up a question?
Well, the thing I find really interesting is perception of smoking marijuana regularly as a great risk declines as the youth get older from 8th grade down to 12th grade. There's a big drop. So I just find that interesting. The perception lessens as they get older, that it being a risk, being a great risk.
Hey, so the thing that I'm noticing is that I feel like we've made some headway in high school, but you used marijuana more once or more in the past 30 days. It's gone up in the 8th grade, which is unfortunate.
Yeah, that's a great point, and I think looking at, we can compare data with different substances, and it's great news that most youth aren't using alcohol, that they're not using marijuana, and we see that it's increasing among some of our students. So definitely a great point. I see SAPCA put in the chat, using marijuana regularly sort of confirms my belief of the importance of peer-to-peer influence. Yeah, that's a great point. If you want to unmute and share more about that, or type in the chat, because I'd love to hear more of your thoughts about what that can look like, or anyone else's.
And to add to Kim's point, there is also a trend in general, in regards to vaping, an increase among middle schoolers. So, and of course, the concern for the dual use of, vape or nicotine and marijuana with vapes. So it also has, everything, of course, has to do with everything, and it's alarming just to see how middle schoolers are consuming more substances.
Yeah, thank you, Natalie. We're gonna look at next tobacco use, so cigarette use, and then vaping. So I'm glad that you brought that up. You're right ahead of the curve there. Any other insight? What's surprising? Any questions that you have? All right, I'm gonna move us along. So looking at attitudes and behaviors regarding tobacco. Again, we have the next slide, we're gonna look at more information about this. But this is looking at, on the left, youth that reported smoking cigarettes once or more in the past 30 days. Perception of smoking one or more packs of cigarettes as moderate risk, and then as great risk. And then over here, youth that reported using e-cigarettes or vaping devices in the past 30 days, and then those perceptions of moderate risk on a great risk. Sorry.
I see that for this sample, the actual general national trend isn't as so, because I see like used e-cigarette in the past 30 days has gone down among the 8th graders, which is good. But then again, this is a sample, and but overall, I'm glad that at least there's still a high-ish perception of smoking cigarettes as a great risk. As well as the vaping, perception of risk has gone up slightly. But I guess there's always more room for improvement and for collaborating and working on this.
Great, thank you, Natalie, and part of why we're here, to move forward together. Other thoughts or questions? Laura says she agrees with Natalie, great. All right, I will move us forward. So now we see, I'm looking at specifically youth that reported using e-cigarettes or vaping devices in the past 30 days. So the main reasons that they reported using those products, as well as the method for acquiring that product. So we see on the left here, they used it because a friend or family member was using it because of the availability of the flavors. They said it's less harmful than other forms of tobacco. So they felt pressure because their peers are using them, or for some other reason. And I do want to point out the yellow X you see just means that there were 2 few responses, so that data was. What do we think about these reasons? Maybe there are other reasons that you're surprised they're not up there. Is this information surprising? All right, I see that Gloria says maybe those reasons include no pressure at all, but just, yeah, but I just wanted to try it out and just curious. Yeah, certainly. I think that's, in looking at, the reasons you're reporting using vaping devices or other substances. Curiosity can be a reason, and we know that we can encourage youth to explore new things that are healthy, that aren't going to have the same effects on their body. So it's a great thing. I also want to point out on the right, we see the youth reporting methods for acquiring electronic vapor products. Oh, I see some comments in the chat. Alina says we see a good amount of messaging about the perception of vapes being safer, but the data here doesn't show that. Yeah, so thinking about what we see within what the science says, and then SAPCA said I think peer pressure and education regarding that would be great to focus on for middle school and elementary. So really focusing early. Great. Thank you, Alina and SAPCA. So method for acquiring, we see you saying that they bought them from someone else or shared them, bought them themselves, took them from a store or another person without permission, got or bought them from a friend or family member, or got them some other way. Natalie says I'm concerned they're buying them from a shop. Morning says huge prevalence of fake ID plays a role here. So earlier in this month, we had an event where teams of youth and adults went out to tobacco retailers and reminded them about the law that you need to be 21 or older to purchase, possess, or use any tobacco products, and that includes vaping devices. So really reminding people. Some people still think it's 18. And giving them those tools and resources to identify fake IDs, to know, what to do in those situations. Other comments?
I just find it interesting about people borrowing them from other people. And I'm just don't know how that works if you borrow a vaping product from somebody else. Anybody have an idea about how that process works?
I guess usually from what I've heard is just a sibling or a friend just giving him to another person, to that person.
Hmm.
That's what mostly I've heard from youth. And that seems to be a pretty easy way to get one, of course, since in theory they can't buy them at the store, but they can still buy them online. Some, not all of the online retailers check ID. But yeah, I've heard just kids sharing them. I've even heard like, fifth or sixth graders coming to school with vapes and they had acquired them from some family or friend.
And I see now that you said merchant education is important in this. And then Morgan said kids with fake IDs buy them for kids that don't have them. I think something that I've kind of seen in pop culture is if a group of people are hanging out, it could be adults, it could be youth, but they have one, vaping devices and they're kind of passing it around. So it's, I mean, sharing is in like in that moment, back and forth. Good question.
Emma, just going off of that really quickly, I feel like I viewed I since the question is or the answer is I borrowed them or shared them with someone else, I feel like I think of that one more about the students, like you just said, who are kind of passing around the same vape. Whereas, it might be interesting in future survey years to change it to I got / borrowed or bought them from a friend, family member, or someone else, and then just say I shared them with someone else for that other response to try and parse out the sharing versus the borrowing.
Yeah, that's a great point. Because thinking about how someone is perceiving the question. Thank you, Nina, for that. Other comments or questions?
I was just going to say it and I think we already know this, but clearly keeping our, whatever programs we have for middle school is important. So I feel like we're making headway in the high school, which is nice to see. So anyway.
Great, thank you, Kim. Yeah, that seems to be a common theme, really focusing on the younger age groups. I'm going to go to the next slide. So we're looking at prescription and over-the-counter medication. And so for prescription drugs, any medication that's prescribed by a healthcare provider, youth that reported using that medication without a prescription, youth that reported using a prescription drug such as Oxycontin, Percocet, Vicodin without a doctor's prescription, using a prescription drug such as Adderall or Ritalin or Xanax without a prescription, and then youth that reported ever using opioids. So unlike the past 30 days use question, that's you ever in your life used opioids. And then on the right, we have youth that's reported using over-the-counter medication and cough medicine, things of that nature to that high in the last 30 days.
It's alarming to see the 8th graders engaging in like riskier behaviors than the 12th graders. For example, the use of prescription pain medicine without a prescription and the use of over-the-counter drugs to get high. For some reason, it's higher in the 8th graders than in the 12th graders. So again, it's like we need to focus on them.
Yeah.
Yeah.
Go ahead.
Oh, I was just going to say, kind of adding to Natalie's comment a few slides back, and it wasn't exactly worded as peer pressure, but the percentage of 8th graders, because my friends are doing it, was higher than high school percentages. So it was just interesting, which makes sense.
I was gonna say, I wonder how much of this is access. So, you see that when you start, as you get older, they, maybe have older friends, kind of different norms about substance use. So I wonder how access plays a role in this. And we have, on this Saturday, we have our drug take back day event. So great opportunity for people to dispose of medication that they no longer need, including pet prescriptions. We really want to highlight the walking medication boxes that we distribute for free as well. So if people have medication and storing it safely, so going at it from those different angles as one way to address this. Other comments, reactions, questions about this data? You see Sergeant Branch says it appears there's a decrease and the kids are getting some information. Great. Thank you, Sergeant Branch. All right, I'm gonna move us along. And I'm gonna pass it to Alan.
Yeah, thank you, Emma. Why don't you take down the slides for a second, please? Because what I wanted to really do is, we're going to do a poll in a moment, but based upon all the data that you've seen, I know some of you were making some suggestions, but so the Substance Abuse Prevention Coalition puts together an annual plan, and the plan really starts in July and goes to the end of June, so it goes in the city's fiscal year. Given the data that you saw tonight across all the different drugs and everything, just generally, what do you think are some of the most important strategies we should be doing that maybe we're not doing right now or should be doing? But what do you think we should be doing or focused on the most at the moment as far as specific strategies, having looked at what's going on with 8th graders, what's going on with the 10th and the 12th graders, and regarding either vaping or marijuana or alcohol or over the counter? What do you think we should be doing either differently or more of that we're currently doing? This would really help us to get that feedback on.
What I thought was, I'm not sure how it's been going right now, but I think every age group needs to be focused on, like, the community needs to focus on one specific either marijuana or vaping or alcohol for one age group, and then for the other age group, see what's more prominent for them and what has increased, instead of saying like, yeah, next year we are only focusing on vaping, rather, and like making it more individualized and understanding our population that we are working on really thoroughly. And then I'm also not sure how the questions are formed and survey question and when they are used, but trying to think about it proactively, what things we are missing right now in terms of the information that would be useful for us for like next year changes. What information are we missing is a very proactive way to think about it and really get that data.
Thank you. Yeah, you know, I was actually thinking that when we were talking about whether that the youth are borrowing them or sharing them, there are some youth who have been identified as violating the school rules that way already. And if there was some way that they'd be willing to have a confidential conversation about, you know, did you borrow it, did you share it, and if so, why, and what was that process, we might be able to have a little bit more information. So I don't know if that's possible working with the school system, but maybe somehow we might be able to do that, delve a little bit more into that, where Lena had talked about breaking up that question, but maybe we could actually have a more listening session type thing with some of the students. They'd be willing to do that. Other ideas, please. Just
Well, I'm thinking probably looking at any education and prevention programs that can be implemented, starting with middle school, I guess. I don't know, it kind of just I was, you know, alarmed at the, you know, the difference in the numbers between 8th graders and 12th graders. And so there's definitely something to do there. I don't know, probably think of any programs that are peer led, because from what I understand, and I can imagine, I guess kids will tend to listen or participate more if they're engaged with someone their own age, or, you know, ranging and not, you know, if I stand there, me as a old lady, and talk to them about vaping, they won't you know, I don't think the message will get through as well as, you know, when they're engaged with peers and maybe have different projects. There are, you know, different organizations of, you know, youth ambassador organizations that really work a lot in this. I don't really know what the city of Alexandria does currently, if there are any programs that they're using, but if, you know, regarding vaping and cannabis use, there are very good programs.
So actually, and Kim, I know you're unmuted, so if you want to go ahead, and then now that I'd love to answer your question. So go ahead, Kim.
Yes, sorry, it's like an act of God to get my computer unmuted. So I think the first person that spoke said something about tailoring programs to different age groups, which I thought was a great idea. I know we go into the middle school, we go into the high school, we do different presentations, different things. But I'm wondering if it makes sense to have, like, you know, vaping be, and I'm just plucking it because I don't remember exactly who's more wet, but like vaping for the 8th graders, or, you know, marijuana for the high schools, you know. I mean, I just think we've got the data, we can see where things are kind of going. And I know we've made a lot of the headway over the last few years with middle school, going into the middle school, but I know there's been some changes. So I don't know if that's changed, Emma, if we don't really have as much access now as we did.
Yeah, so I think you can look at it from a couple of different angles. Last spring, we delivered presentations to students at 3 or 4 different schools with middle school population. We have not done that this year. We will have that focus on high school. We do have a group of high school students, the Keep It 362 advocates, and these are students that are employed through the city of Alexandria, and they support prevention and outreach efforts. One of the ways they do that is visiting after-school programs at several sites once a month and delivering those peer-to-peer workshops that Natalie, you mentioned. So those workshops cover a variety of topics. They have a vision board focus, really planning for the year. They do a couple of really funny activities. So with, they do a skit and all the kids are cracking up. They talk about Instagram versus reality. So I think sometimes we see something on social media, we see something in a movie, and we have that picture in our mind versus what is actually happening. So those are a couple of focus areas for middle school. And I don't know, am I missing any middle school efforts?
No, but in addition to talking about social media or whatever, they do talk about alcohol and other substances too. They have so what we try to do, because we're multiple programs or working with the Keep It 360 students, peer advisors, is that they take a topic a month and work, and there is a couple of months throughout the year when it deals with a substance. But again, this is based upon the clubs at different middle schools that are going on. So yeah, that's. I do, and the student ambassadors we have, I can't that the city has started, or I don't know if they're getting as much involved with this process yet or not.
So actually, the Alexandria Youth Ambassadors have been helping out delivering those workshops. So thank you for the reminding them. I see we had a couple more comments in the chat. So Sergeant Branch says more emphasis on targeting middle school children, kids programs, education, and looking at that information and programs that are available to help them from making bad choices. It appears a lot of these come from seeing family or friends. Yeah, and this is something that comes up a lot, modeling, that role modeling. Kids are always watching, and they pick up on what you say and do. Gloria says directed education starting at 6th grade from high schoolers. Great. And then Sergeant Branch says more mentorship involved. So these are all really great ideas. Oh, one more, focusing on overall well-being and stress management to avoid using substances to cope with trauma / mental health issues, etc. Definitely. I think with the COVID pandemic, there seems that there's a lot more conversation about mental health and the importance of coping. And I think that's definitely one, silver lining, and we see the connection between use substance use and mental health. So thank you.
Great. Other ideas about, for instance, where we're seeing a lot of the perception aspects about perception of risk, with particularly, for instance, like alcohol not being that high. Ideas or suggestions that we should be doing better on as far as tactics or strategies.
In terms of perception of for risks and stuff, I think like presentations and those information are really good for youth. But what I often find is that when we have recent findings, and we have a lot of recent finding regarding vaping and more information than past years in public health and medicine and stuff. So really finding people, reaching out to people that are in those fields to be able to see if we can connect with them, to give like presentations and in our community sites, and also maybe even high schools and stuff. I think it makes a big difference when someone says, hey, I've been working in this field for like 80 years, but versus like just us giving presentation. Like for us, we know that we're using the information that is accurate, but for teenagers, they think they don't really understand sometimes that the depth of the research and the reality that is in these presentations sometimes.
Excellent, thank you. Good idea. Anybody else?
I think maybe also holding some smaller conversations with youth to get a better understanding of what, why, or more about how they're not perceiving the risk. Like just to kind of see if it's like a knowledge gap, but then more specifically, what about that knowledge gap? So I think someone mentioned earlier that, people or youth might have family or friends that they see drinking 1 or 2 beverages a day, and their family or friend appears fine. They appear healthy. So that makes their perception of the risk go down. Or is it more like the person who was just speaking, is it more that they're not educated, or they haven't had as much education on the different risks of long-term alcohol use? I don't know if that made sense, but just kind of understanding a little bit more what the disconnect is. Why don't they think that there's risk in these behaviors?
Okay. No, it makes sense. Thank you, Lena.
I was gonna say, I wonder too, when we're looking at risk, I think that you can look at it as risk to health. And someone's like, oh, I might get lung cancer in 20, 30, 40 years, but now I'm fine. But we talk a lot about, risks to relationships, risks to, if you want a job and they do, drug screenings, that can affect your employment. So, I think you're getting at a really good point. This data can only tell us so much. It's a snapshot in time. And so being able to have those conversations of, what made you just, why do you think you responded this way? And what are reasons that people would say this is a risk I don't want to make? So thank you. C. Sergeant Branch says, more focus on families understanding how their actions and habits are influencing their children. Yeah, I think that's a great point.
Yep.
And thinking about how we can, make sure families feel like they have the tools, they have the information to have those conversations. Other thoughts, other suggestions?
Okay, well, these all have been great ideas. We really appreciate it. If later tonight or tomorrow or whatever, something pops in that you said, oh geez, I wish I had mentioned this, please shoot Emma an email or me an email and let us know. And because that would be very helpful. I do want to mention that Kim is a member of the board, the Substance Abuse Prevention Coalition. I didn't want to go away and not recognize her. And also Lena. So we talk about the Youth First Behavior Survey data. Lena is an epidemiologist in the health department and was responsible for analyzing all that data. and putting it in a wonderful, understandable report. So I also want tonight and in front of all you too is to thank Lena for all the work that she did and her colleagues in the Alexandria Health Department in the process. So, and with that, Emma, I believe we have a poll.
Yeah, so we have another poll. So again, y'all provided a lot of great feedback, and I think this poll will help us figure out how to launch it. This poll will help determine those next steps as well. So you should see a poll. It says, based on these discussions, which substance should be SAPCA's highest prevention priority? So you just pick one. There's no all the above. For this, just a minute to let us know what should be the highest prevention priority. Many more seconds. So you have a couple more responses, and then I will share the results. So I'm going to share the results. So you should be able to see them. If you can't, if someone please let me know. I get a thumbs up that y'all can see.
Yeah, we can see that tobacco, e-cigarettes, vaping came in with 50%, alcohol with 38%, and marijuana with 13%. So yeah.
Great.
So
Thank
that's
you.
very useful. Thank you very much. As the team, as our board goes in and starts looking at revisions to our action plan for next year, we'll be incorporating a lot of these ideas, particularly about talking to the youth and getting more understanding with and also with the families about how their impact and perception. So I think all of us kind of agree, at least my understanding is that we really need to focus a little bit more on perception than we have been doing in the past. Also understand the idea that you bring in experts to talk about it, sometimes particularly the risk, it makes a much more impact as Safa was mentioning than one of us talking about it. So luckily we're in an area where there's a number of experts, national experts. So we will think about that too next year as we move forward. And luckily, as we moved into Zoom, sometimes it's easier to get experts on a Zoom presentation as well. So we'll do that. So Emma, you had mentioned a couple of things that are coming up, but you want to mention as we move into community announcements?
Sure. So I mentioned the drug take back day is happening this Saturday. You can dispose of medication from 10 a.m. to 2 p.m. at several sites in the city. There's also a bunch of community cookouts coming up for the next couple of months. So SAPCA will be at some of those if we're not there. We have partners that we work with, so we can share information. We have these great parent handbooks that are a great resource for parents and for young people to start the conversation about different topics. I would also point out our newsletter. I'm gonna put a link in the chat. If you don't already get it, it's a great way to learn about events that SAPCA is hosting, events that other community partners are hosting. I know our partner, the Alexandria Campaign on Adolescent Pregnancy, is hosting a community meeting in May, and we are in the early stages of planning the Youth Leadership Conference for August. So if you don't receive those emails, go ahead and click the link in the chat. Okay, and I can put the flyer for Drug Take That Day in the chat as well.
And Emma, would you please mention the medicine boxes?
Yes. So in addition to encouraging safe medication disposal, the city also distributes free locking medicine boxes. So a way to store medication safely. And those can be picked up at 4850 Mark Center Drive. They can be picked up at the sheriff's office. There might be one more location in not TGI. I will put information about that program in the chat as well.
Well, thank you all for joining us tonight. Thank you for your input and your information for us, helping us get think of better about how to approach some of these issues that we're facing with our youth. And again, if you come up with something else that you didn't bring up tonight, please shoot us an email. And of course, if you want to get involved with the Substance Abuse Prevention Coalition, we'd love to have your involvement either as a specific project or on the board or something else. So with that, for myself and Emma and the board of directors for the Substance Abuse Prevention Coalition, I want to thank you all for joining us tonight, and look forward to seeing you sometime very soon, hopefully at maybe one of the community cookouts or at one of the community events or at Drug Take Back even this Saturday. So thank you all. Have a wonderful evening.
Hi, thank you.
Bye.
Thank you.
Thank you.
Thank you.